Zoliswa Gidi-Dyosi was the country's first health worker to receive the jab. She couldn't contain her happiness.
So happy. I was so happy by the fact that I have break the record. I was told this morning that I will be the first to receive this COVID vaccine 19 in the whole of South Africa. So I was so happy. To me, yeah, I'm so happy. I was so happy. I'm still happy even now.
Hospital staff working in intensive care units should be prioritized for the COVID-19 vaccine. Principal investigator for the Durban International Clinical Trials Unit, that's Umesh Lalu, says they have the highest risk of infection. He says guidelines should be drawn up as to which healthcare workers should be prioritized.
We've been working in the intensive care, managing patients, and basically it's a very close contact with patients. So my view is that those are the categories of healthcare workers who should be vaccinated first, or at least early on in the strategy. And that includes nursing staff and allied staff that work in ICU. And over and above doctors like myself, I think the nursing staff who spend almost 12-hour shifts on close contact managing these patients should be top priority, because that's where the highest risk lies. So I think government, taking its advice from its scientific committee, from its medical advisory committee, would have worked this out and strategized, and given the limited supply of vaccines, that they would then stratify who should get it first. So we hope that that's what will happen, and I hope that a very clear communique will come out so that we are not allowed to speculate any further.
The Western Cape Health Department says it won't be able to vaccinate rural healthcare workers for now. That's because there aren't enough shots to go around. Provincial Health MEC Noma French Mbombo says she will not be vaccinated as frontline workers are priority.
Well, the Western Cape took a decision on the equitable access because among the healthcare workers, you still have got those who are more highly risked in terms of the exposure, and also in regard to the individual vulnerability, and therefore I cannot jump the queue. But it is also crucial that this is a minimal of the doses that we are receiving now out of the 80,000. The last time I checked, for us, we are going to be allocated 13,000, which will be divided according to the two sites that have been mentioned. So with that 13,000 that we are getting vis-a-vis the 133,000 that we were initially expecting according to the phase 1, how do I jump the queue at the expense of all other healthcare workers? Because as long that they are not safe, I'm also not safe. Take also into consideration for this phase, the rural healthcare workers are not included. But what we have done is to ensure that at least there is a variety of the other healthcare workers. The EMS, as you can see, I'm wearing the EMS jacket here, the community health workers, nurses and the doctors, and also not only the tiger bag and the Grooteskier staff, but also the feeder areas from the primary health care and all of those. So we have to consider that.
So who will be the first person to get the vaccination today?
Healthcare worker. We do have a nurse, we have got a doctor, we have got also a community health worker, also got another category, because these vaccines, especially that South Africa has been given the emergency approval specifically for the implementation in order not to wait for longer for the health workers to be able to get the vaccine. So they will be the ones that will be getting the first vaccine. As you correctly indicated, that we are waiting for the President, the Deputy Health Minister and the Health Minister, which I don't have a confirmation for now whether they'll be vaccinated or not, but let's give them an opportunity they can explain themselves.
The Gauteng government will use a ward-based community approach to ensure enough people are inoculated. The rollout of the COVID-19 vaccine will take place in 3 phases.
This is part of the study, and after the study we'll then roll it out. We'll start to vaccinate the remaining number of healthcare workers from the 215,000 that we had identified for the first phase. And we are going to move on to the second phase. The second phase will move over to some hospitals and in the main the primary healthcare facilities. Those are your clinics and your community health centers. Then the third phase will be when we are vaccinating everybody that's above the age of 18 and that have got no comorbidities. That is the entire population, to come up with the 67% that we've set ourselves as a target for Gauteng. That is going to be a huge program, because it's close to 3 million people that will be vaccinating in phase 3. So we have been preparing for phase 3. We're not waiting until the day of the vaccination. We are working very closely with the municipalities, because we're going to be using churches, we're going to be using halls, we are also going to be using our own facilities to ensure that vaccination is accessible to the 3 million people that we've targeted in phase 3.